All right. So, hello everyone. Thank you for stopping in to listen to our residency roundtable talk today. I am Jim Devanney, and this is Janet Tam. We are both senior tutors at Elite Medical Prep, and we're both DOs. So we are leading the conversation on specific considerations for DO students as they're applying for residency. So we hope this is helpful.
Thank you for the introductions, Jim. So we'll just start off with the agenda that we have today. As a general overview, we will give some background on differences in the application process for DO applicants. So we're going to go through background, exam choices, specialty considerations, auditions, ERAS applications, interviews, and finally the rank list.
So for some background, medical residencies first started to be recognized for MD applicants or for MDs in 1889. The first DO residency was created in 1947. In 1962, there was a proposition in California that attempted to end osteopathy outright. So thereafter, it failed. The AMA in 1969 approved DOs to matriculate into allopathic residencies, but since that time, there were two main matches. There was the DO match and the MD match. This continued until recently in 2020, when all residency matches were joined as one. So in the wake of that, that raised a lot of questions for what does it mean to apply as a DO? What does it mean to join these residencies, and how does that impact the slots that DO applicants are applying for? So theoretically, making this an even playing field. But we'll talk about that a little bit more.
Thank you for that, Jim. So naturally, the next question that a lot of people will have is in regards to the exam choices, now that everything is merged, right? So the DOs classically, they have the COMLEX, the MDs will take the USMLE series. So a little bit about those two exam choices here. Both exams were created in 1990s, and historically, allopathic programs are more comfortable with the USMLE. And so DOs also started to take the USMLE for more competitive specialties. So in 2022, recently, both the COMLEX Level 1 and the USMLE Step 1 exams became pass-fail.
All right. Thank you, Janet. So I have a couple questions now based on the idea of exam choices. How important is it to take the Step 2 exam now for DO applicants?
That's a great question. So since the COMLEX Level 1 and the USMLE Step 1 are both pass-fail now, there will be a shift in the emphasis to Level 2 and the Step 2 exams instead of the Level 1 and Step 1 exams.
Great. Makes sense. Now, if a DO applicant wants to take Step 2, are they required to take Step 1 to qualify and take that exam?
No. So you do not need to actually take the Step 1 in order to sit for your Step 2 exam. So let's just say you are thinking about applying to a very competitive specialty and you want your Step 2 score and your Level 2 scores to reflect that, then you may choose to just take the Step 2 exam and not having to take the Step 1. So it saves you some time and money there.
Great. Is there any reason at all to take Step 1 as a DO applicant?
It's not absolutely necessary since it is now pass-fail. So if you're a DO student, it might just be a good idea to take the COMLEX Level 1, which is required for your licensing. And to talk about some pros and cons, if you're still thinking about it, some pros about taking the step one is that, you know, in the process of preparing and taking it, it might better prepare you for clinical rotations and eventually to do well in the step 2 exam. But on the other hand, some cons about that is that if you do fail step 1, it may not look so good on your applications. And it can also be stressful and add to fatigue from studying. So this can be highly individualized, whether you take it or not.
That makes sense. Thank you. And how much time should I spend studying for each of these exams? Do you have any suggestions on that?
Definitely as much time as you possibly can. But let's just say you have an 8-week dedicated study timeline, like most people do. You should be studying at least 8 to 10 hours per day, and to also focus on active learning techniques. And we can talk a lot about that in the future. But basically, it stems from focusing on using practice questions as your main source of learning.
Awesome. And when should I take the exams? Is there a sweet spot? Is there a time when I should take STEP versus COMLEX? Any suggestions on that?
Right. Yeah. So for the COMLEX level 1, ideally you would have taken it between the summer of your 2nd and your 3rd year of medical school. Although some schools do take it between the 1st and 2nd year, depending on how the medical school is set up. And for the level 2 and step 2 specifically, if you are thinking about taking both of those exams, you may want to take the COMLEX level 2 and the step 2 about a week to 2 weeks apart from each other, like most people do. Most people usually do the step 2 first and then spend 1 to 2 weeks focusing on OMM concepts and then taking the level 2 after that. And the ideal time to get both of these completed is before the ERAS applications are due, because most programs actually will download the applications immediately when those ERAS applications are available to them.
Yeah, that's very helpful. Helps to put everything into perspective. So next up, I'll talk briefly about different specialty considerations. As we kind of alluded to above, since there has been some murky waters or some concern or question about where do we stand as the matches have joined, does it impact the specialties you're applying for? And the truth is it may. And so you think about that with the more competitive specialties, the things like orthopedics, neurosurgery, radiology, and the like, where there's already few spots that everybody is competing for. Previously, there were some spots earmarked just for DOs when the matches were separate, and now that's not entirely the case. So as far as trying to figure out or to evaluate this, there's different websites, whether it be FRIDA, Residency Explorer, or NRMP Match Data, that talks not just about overall as a specialty, what matching looks like, but you can find out different information about specific programs. So you can also direct yourself a little bit more on certain specific programs. That's something that we'll talk a little bit more in the future as well.
Thank you, Jim. Now, I'm sure a lot of people have questions on choosing their specialties, especially as a DO. A lot of people want to pursue competitive specialties and don't know where they stand. So let's talk about and answer some of these questions. So let's start off with, how should I choose my specialty?
Absolutely. So first and foremost, you have to be true to yourself. You need to do a lot of soul searching and introspection, figure out what it is that makes you tick, what it is that you can see yourself pursuing. Of course, investing in those who know a lot about you, asking questions, what people around you can see you doing, what they have thought about, or what they can see you in. But at the end of the day, what you want to take into consideration is what you can see yourself doing 10 years down the road, and really pursue that.
That's great advice. I love that. And the next question is, I'd really like to pursue a competitive specialty. Is this possible as a DO?
Absolutely, absolutely. So the short story is that we're all competing for these spots, and there are objective measures in place that schools and programs are using to assess their applicants.
Thank you, Jim. So how can I make myself a competitive applicant?
Yeah, so started to kind of get onto that a second ago, but the the best thing that you can do is start early, show interest, be involved in clubs, volunteer, do research, and of course, do well in your classes and do well on boards. The easiest way to get a door closed on you in a competitive specialty is um, by not doing well on boards. So best thing you can do is keep those doors wide open and prep as well as you can for your boards.
Awesome. And the last question regarding specialty considerations is, should I apply for a backup specialty?
So that is a great question. I think it's something that is it's individual. The answer to that is not just an easy cookie cutter thing. For some people, they can't see themselves doing anything other than the specialty that they are pursuing first and foremost. For some people, there's another specialty that they think that they can be happy in, and that's wonderful, and that you can apply to both. The consideration and the caveat is that you have to split yourself in that way. You have to think about how you can perfectly craft an application for two separate specialties, how you can apply to the appropriate programs, how you can kind of keep your mind straight even on interviews. And I remember for me when I was applying, even just for transitional programs in PM&R, it was very difficult on the transitional or internal medicine interviews for intern year to kind of divorce myself from the PM&R mindset, the PM&R application mindset. So doing that with two separate specialties on the whole, I can only imagine being more amplified, and then of course the cost associated with applying to more programs and then interviewing with them as well.
Yeah, definitely. So it requires more time and more money as well. So it definitely takes some planning and needs to be individualized. And so going off of that, the next thing that may be important for DOs, and especially if you are considering a competitive specialty, are audition rotations. So we also have some questions for you about that, Jim.
Of course.
So the first one is it necessary to do audition rotations?
So I wouldn't say it's entirely necessary. I think it's one of those things that's highly encouraged and almost expected. It's becoming more and more important as time goes on, especially as the interviews have remained virtual, the getting FaceTime with programs, and additionally showing your interest in the field and the program specifically. It's becoming more and more important to seek out those opportunities as you can. The biggest thing with that is you need to be putting your best foot forward for it. And one other consideration for us as DOs is a lot of DO students and DO programs don't have specific home rotations in some specialties that you would be able to otherwise get that experience. And so that's another way that auditions can not only help your chances at a certain residency program, but also further show you what you're applying for.
Yeah, those are great thoughts. Definitely audition rotations are not necessary, but they are becoming highly recommended. So how many audition rotations should I do?
That's another question that it's very individualized. It's a great question because of that. The typical course is DOs do more audition rotations than do their MD counterparts because of some of the things we discussed above, whether that be lack of rotations at their own home institution, the need to get more face time, and to demonstrate their interest in the field and in the program specifically. But in general, it also does vary with the specialty that you're applying for. If you're applying for something that's incredibly competitive, you want to use as much time as you possibly can to get that face time, to show that interest, to be at these different programs. If you're applying to a specialty that you feel very comfortable and confident in your chances, and you don't feel the need to either do any or do less, then that's also perfectly acceptable. It's just knowing that both options are both valuable and worth considering.
Okay, and how do I choose where to audition?
That's another great question. So first reason would be, are these programs that you can see yourself going to? Do you have a reason why you like certain areas, geographic preference? You have family in a certain area? Are you open to all locations? Are there certain programs that are more of a reach that you would want to have that time with? And then trying to determine, and this is tough as you're applying to residency, do you want to do academic or community? And that's something that, to be honest, might change while you're in residency. So getting experience with both options is not a bad idea either. So just trying to get as much exposure for yourself as well is important.
Okay, and where can I find audition rotations? Any deal-friendly ones?
Yeah, so the VSLO is it stands for the Visiting Student Learning Opportunities. It's a platform, a program that's run by the AAMC that kind of fosters these elective audition rotations. That's the primary way in which people find their audition rotations. There's also other ones, though, with the Clinician Nexus and program website specifically. You can email coordinators, word of mouth. And if you want, as we kind of talked about above, different ways of finding specific DO-friendly programs is via platforms like Frida, Residency Explorer, the NRMP, Match Data, National GME, Census Survey, and just looking at individual programs' websites to see their current residents, their recent graduates, and things of that nature.
Thank you. Those are really great resources for our DO students. So what are some differences between audition rotations and your normal clinical rotations? Is there anything that I should do on audition rotations to help make me stand out?
Yeah, so that's the other important consideration of these audition rotations, is you are being closely watched. The good and bad of it is that you get to demonstrate who you are and what you can do. So you might be treated as, or you want to treat yourself as a potential resident. So you won't be taking on the same exact roles as a resident, but you'll definitely have more responsibilities than your other rotations in med school at that point in time. You'll be carrying patients, you'll be writing notes, and it's important to make a good impression, to show that you are interested, to show that you're engaged, that you're ready to learn, and that you want to play as a team player. And so it's just it's important for you to really put your best foot forward. So, and it's important, before we move on too, I just want to also kind of to put out there that audition rotations, yes, they are for you to showcase yourself to the programs, but they're also for you to see these programs from the inside. That these are not all putting yourself on the line and trying to sell yourself for this program, but you're also interviewing that program, and that should be something that you're paying attention to while you're there as well.
Yeah, that's absolutely true. Thank you, Jim.
Of course. So with that, let's move on to the next phase of our talk with the ERAS application, the dreaded ERAS application. So I am going to ask you some questions on this one, Janet, if that's okay. How do I choose what programs that I should be applying for?
Yes. So as a DO, I think it is important to be familiar with programs that historically take DOs and those that do not. And so you can learn a lot about this information on websites, the program websites. You can check their list of residents. You can check their explicitly written requirements to be considered for an interview. You can look at programs that have taken people from your medical school before. And you should also pay attention to the program's COMLEX versus USMLE cutoff scores and see if you meet those cutoff scores. And lastly, I would say to apply more broadly, and I mean this in terms of geographic region, urban versus rural setting, and community versus academic hospital setting to give yourself the best chance of matching.
Awesome. That's really helpful. And so now that I have this massive list of programs that I may want to apply for, I'm starting to look at how that costs my lineup. How many would you suggest that I apply for? Is there a sweet spot?
So yes, it is true that applying to residency programs can get very costly. But, this is something that you want to do once and never again. So it's important to do it right the first time. And while there's no magic number of how many programs you should apply to, because it really depends on, your individual stats and also your goals and the specialty that you're considering. But just generally looking at, for example, the 2022 match data, according to the AAMC, MD applicants have an average of 68 applications in 2022, while the DO applicants submitted 92 on average. And then, of course, if you look at the breakdown of the more competitive specialties like plastic surgery, interventional radiology, dermatology, those also on average of 80 plus applicants per student. And that is about like a 10 to 15 increase from the previous years. And even in less competitive specialties like internal medicine, graduates apply to an average of 70 plus programs. So it is becoming increasingly more competitive. And so I highly encourage looking into this data and especially considering what specialty you want to do and tailoring your application from there.
Wow, that's a lot of very, very good information. That's a lot of programs too. So with that, I'm going to move us a little forward. Now we've sent out our ERAS applications. We're starting to get our interview invites coming in the mail or email now. So how do we approach this? Overall, so there's another great lecture that's been presented in this series already, talking about the specifics of interviews. So we won't go into that information. We'll just kind of talk about the DO specifics here. So the big thing that everybody will wonder about, and the things that I'm sure you're thinking about now is the dreaded why DO versus MD question on the interview. And the big thing with this is to not shy away, not use this as something that you're trying to hide, but try to stand tall and proud and say, this is how it makes it a strength for me. This is what my experience has been, and this is what I can bring to the table. Be confident in that. Know who you are on that, and be able to talk to that specifically. So specifically in my case, I went into PM&R for residency, and that's one of those fields that this question was a very easy answer, because all the additional MSK knowledge that we got in OMM and throughout my DO training definitely helped, not only in speaking to that on the application, but throughout residency as a whole. There are other things that I had already seen and started to get a grasp of before even coming in. So being able to speak to ways in which this can be an additional strength will not only be helpful for your own mental health, but also for relaying that to the programs and showing that. So additionally, not only just speaking to the strengths and the way that this can help the program, the one big thing as well is to not be negative. Not only do you want to have glowing ways of how this is going to help you in your training, but the biggest thing that can be a huge red flag is to speak negatively about DO programs specifically, and then also to your med school, because that reflects on, or at least can be interpreted by the program as ways that can reflect on the program in the future as well. So don't fall into that trap either. So now, after interviews, we've gotten through the grueling interviews, as many as we could, and now we're moving on to the rank list, the last, or one of the last and exciting pieces here. So Janet, I'm going to ask you first off, how should I make this rank list? What considerations go into that?
That's a great question. As we discussed earlier, it kind of is a culmination of all the parts that we talked about prior, right? So the geographic preference, the program specifics, right? Are you interested in research? Do you want to be in an academic versus community hospital setting? How did the interview day go? Do you get along with the residents, faculty, attendings? How was your audition rotation at this location? So basically, the big questions you should ask yourself is, do you think you'll get along here, and will you be happy there?
Great advice. Thank you. And lastly, should I rank one program over another based on how I think they think about me? Should I rank a program that I think I'd have a good chance of matching higher? Or how should I do that?
So really, the answer is there's no cheating the system. You really should rank according to where you want to go truly, right? So the NRMP matching algorithm is really an applicant proposing algorithm to place applicants in their most preferred residency. So definitely go by your rank list, how you truly want to rank, and not by how you perceive your chances of matching.
Great advice. Great advice. Thank you. All righty. So we are now at the end of our talk. Thank you very much for your attention, and we hope that this was at least somewhat helpful. We know that this is a busy, grueling, stressful time, and just wanted to close with saying that the Elite Medical Prep, we have residency advising, interview prep, personal statement assistance, and more. Additionally, of course, tutoring services. But now we're on to residency applications. If you ever do feel the need or want to find out more about these services, the information for a contact call or email or looking at the website is below.
Thank you so much for coming to our talk, and this is the end of the presentation.
Good luck, everybody.
Good luck.